Well, Dr. David Smith, thanks for being with us tonight. We're going to do another Facebook Live session. So this really turned out well last time. We had a lot of engagement, lots of questions and answers. So appreciate you taking the time to do this with us.
Certainly, and hope to provide more answers tonight.
And I think it goes without saying we have a lot of ground to cover. So we'll try not to talk too fast, but we do have a lot of great information. We certainly want to monitor questions too. So I'll just throw questions out as they come in. Let's just start quickly before we go into the reopening plan that's just now being released. Last week, we had a major announcement, and that involved adjusting the start date of the school year. So you just want to say anything about that again?
Just briefly, because of the exponential growth that we've seen in positive cases in Vanderbilt County of COVID-19, we did decide to delay the opening of school for 2 weeks. So instead of starting on August the 5th, we're going to be starting on the 19th. And when we start on the 19th, we're going to start with just half of our students in attendance. So for Wednesday, Thursday, and Friday.
Yeah, and we're going to pull up a graphic so we can take a look at this to explain
Students with the last names that end in A through J will attend then Wednesday, Thursday, and Friday, the 19th through the 21st.
Okay.
Also for families that are blended families, if you have
Sure.
kiddos that have two last names in your household, two different last names, they would all attend that week also. So then the rest of the students whose last name ends in letter K through Z, they would be in attendance then Monday through Wednesday, the 24th of August through the 26th, and then everybody is in attendance the 27th and the 28th. The rationale for that's very simple. Lots of things are new, and until people understand that if they don't have that in their schema, then they need to see it and be able to experience it. So this will be our way of gradually rolling this out to our students, so we will ensure greater success that way, so they understand social distancing and all the expectations that we have for them this year.
And we also understand, too, of course, our students have been out of school formally since mid-March as far as being with us. That's a long time. And we understand the value of forming those relationships, and we really do think with these smaller numbers on this staggered start, it's really going to put our students and our teachers in a good position to get off to a successful start.
Correct.
Okay. So let's move on then now past that, and let's start talking specifically, Dr. Smith, about EVSC's reopening plan. So we've put this together. It's now posted on our website, and certainly you can see it in its entirety. So anyone listening to this, not only are you going to see it on the screen, you can go to the website, you can read the entire thing. So I think that'll be helpful information. So why don't you just take it away, start taking us through that,
Certainly.
And then I'll throw questions at you as they come in from those people that are listening.
Thank you. And first of all, I want to extend a huge thank you to everyone who has contributed to this reopening plan. It is a monumental task, and it has been 5 months in the making also. So thank you to everyone. First of all, the goal of this Facebook Live session is to continue to provide information and then also feedback from our public. Just want to reiterate that school-specific plans will be out at the end of by the end of this week. So just want our folks or families to continue to look for those. But once again, we're talking about enterprise or district level.
And those school-specific sites, if you have a question, if your child goes to whichever school and you want to see those specifics about how, for example, arrival or dismissal will work at your school, that's what you'll go to. Because you're saying this is EVSC.
And we'll certainly we'll provide an example of that toward the end of this Facebook Live session. And then third, I want everybody to understand that this is the plan as of now. The overarching precepts are not going to change, but as the conditions change within our community, then this plan may be altered. So once again, this is the plan as of now, subject to change due to prevailing conditions within Vanderbilt County, but this is what we are working with now. And then finally, as you look at the table of contents, this reopening document is really organized basically past the introduction with the guiding principles. Then you can see the resources and research, and really it's more about resources. We've done a tremendous amount of research which has informed our processes and protocols, but we just wanted to list some of the more salient resources for you. Then we'll discuss our operating levels, discuss what those mean, what it looks like, how that informs the academic plan, then the health and safety plan that we have for all of our students and staff, then finally disinfecting, cleaning, and then the operations plan. So the first letter or the opening in the introduction on page 3 is really just my letter. I would simply want to draw your attention to the third paragraph. You can read this at your leisure, but the third paragraph, I think, once again, talks about how we wish to communicate with families. And then additionally, as we have said, you may always contact us through that evscschools.com through the Contact Us button on that webpage.
That's right.
It's very important that we do have that collaborative two-way communication. Next, guiding principles. So these guiding principles really provided focus and then that intentionality for how we make our decisions and how we've made the decisions that we've made. So first of all, health and well-being of our students and staff is of paramount importance in this pandemic. Then secondly, we wanted to make certain that we were providing options to meet the needs of our students and families. We have 22,000 students. We have many different needs in our district, and I'm very proud of the plan that we put forward because it does meet the needs of our students. And then finally, collaboration and cooperation for all community stakeholders. I don't think that was ever more evident than the press or the news conference that we had Friday, basically where I really did implore Vanderbilt County, please make certain that you take the steps necessary to mitigate the spread of COVID-19. The success of our reopening plan is only going to be as successful as the community allows it to be with the actions that they take outside the four walls. Vanderbilt County health official, I think, said it very eloquently. The concern really isn't what happens within your four walls. The concern really rests with the behaviors of the Vanderbilt County residents, those that work and live in Vanderbilt County.
And we've heard it said before, too, if you want kids back in school, we all have to work together on this to get these numbers down in our county.
So then moving forward past the introduction and the guiding principles, we talk about resources and research. And really here, as I alluded earlier, these are the guiding organizations, the CDC, the Indiana Health Department, or Department, and then as well as the Indiana Department of Education and the Vanderbilt County Health Department. There are some graphics at the bottom of that page that have been taken from, I think these are from Vanderbilt County specific, the Vanderbilt County Health Department. But that's just a small snippet of some of the data that we've looked at. Then the following page, though, when we look at this that has the graphic of the 11 symptoms of COVID-19, this is from the Indiana State Department of Health. And just want to quickly review this, but we wanted to insert this as one quick, easy, handy reference for parents. I know that oftentimes you're bombarded by information, but if you can just grab it at one side, I think it's clearly a benefit. But we are asking every parent to self-screen their child before they come to school. Why is that? That's because that's based upon the recommendation of our state health commissioner, Dr. Box. So, number one, your student does not have a fever greater than 104. That was what the Indiana State Health Department put out, but they also put, but it may be lower based upon the school's policy. We've always utilized the standard of 100 degrees, so that's what we're going to ask our parents to abide by. So if your child has a temperature of 100 degrees or higher, please don't send them to school.
And again, just to clarify, you may have seen somewhere 100.4.
Right.
For consistency, we're going with 100 degrees.
Right. It's not 100.4. It is 100.0 for our purposes. Number two, there are 11 signs of illness such as congestion, the fever, a cough, shortness of breath, diarrhea, headache. You can see all 11 that are posted there. So if your child shows any one of those 11, keep them home. Okay? Number three, if you are in close contact, and that close contact definition is within 6 feet or less and 15 minutes or greater with anyone that is confirmed with COVID-19 within the last 2 weeks. If you answer yes to any of those three questions, then please keep your child home, contact your healthcare provider for their recommendation of next steps you should take, and please contact your school.
Okay. And I want to interject there with this question, Dr. Smith. So, you know, we always, all of us, going back to our own time in school, you think about that good school attendance, and certainly not suggesting that it's not a great thing to have good
By the
school
way,
attendance.
there are no perfect attendance awards this year.
So let's elaborate on that. And we've said before, not to be a hero this year, perfect attendance kind of out the window. Why are we saying that this year?
Well, because I think you've really alluded to it. In the past, it was almost standard of honor that I can fight through this
Sure.
cough, I can fight through this fever, I don't feel well, but I'm going to go
Take
ahead
a little
and tough
bit of
it
cold
out.
medicine
Yeah.
and push through
Well,
it.
folks, this is a pandemic, okay?
Right.
And we are trying to do everything humanly possible to stop the spread of the pandemic until we get either herd immunity or until we get a vaccine that works. So that's why this is a different year. That's why we have taken extraordinary measures that we've never taken in the past. But it's so important that parents help us to do this self-screening. Once again, if you answer yes to any of the questions or any of the on the screen, if we could put that back up again, any of these 3 questions, make sure if you answer yes to any of those that you keep your child home, contact your healthcare provider, contact the school.
Okay.
Okay, and then moving forward, if we could advance to the next page, I appreciate the Indiana State Department of Health putting this out. So if you look at this, this takes a while, I think, to orient yourself to this chart, but basically on the left-hand side, talking about the individual. In the middle, if that individual is symptomatic, and then what you do based upon the individual frames that are on the left side, and then if you're not symptomatic, particular steps. So I want to go through this just to make certain that we're all on the same page, because I think fundamentally if our folks out there understand this, this will go a long way in helping us to understand.
No, I think you're right, and I'm going to have you go through that, and then I've got a question some people have been asking, and you might address it here. So let's go through this, and then I'll throw this at you.
Okay. So this is not just for a student, not just for faculty, but this is really anybody in the community. This is specific to school. So once again, if the individual has not been tested and they have an alternate explanation for why they are symptomatic, then when you look in that middle, on the top row, but in the middle, they may return to school after 24-hour resolution of fever and a note from their healthcare provider stating that the individual has some kind of alternate diagnosis.
So coincidence that is exactly where you went with that, because Alicia asked, and she is one of many that have already chimed in, if you have that single type system, but you have documentation from your physician of a pre-existing condition that's causing it, then that is a different situation.
Yes. So I think there are several things to do now. First of all, if you want to get just make certain with your healthcare provider of how they want you to interact with the school. But for instance, I know that we have allergy season coming up in the fall, and some folks have allergies now. So if you're sneezing a lot, coughing, and that has been associated with, those symptoms have been associated in the past with your allergies, then make certain that you have a healthcare provider statement to that effect, and make sure that that healthcare provider faxes or sends that information into the school. And it will be on a per episode basis. So we don't, and what I mean by that is you can't really get the healthcare provider to provide that excuse for you now for something that may come up in October.
Okay.
So I just want to make certain that we're clear on that.
And as you're going through this plan, we certainly are not trying to be difficult. We're not trying to make life harder on parents. We understand the situation. We just have to be so extremely cautious this year.
Yes, this is difficult enough without us trying to add to the mix. Once again, this is guidance, once again in this section, and a resource that's put out by the Indiana State Department of Health.
Yes.
So this is their policy, their guidelines that we certainly will adhere to.
Okay.
So then when you look at the second row, so you're not tested and you are without an alternate explanation. So in other words, if you're symptomatic, okay, but you've not been tested and you don't have allergies, so then you have to remain at home for at least 10 days from the first symptom.
Okay.
And you have to be fever-free without fever-reducing medication for at least 72 hours.
Okay.
Okay, so, and then also with improvement in respiratory symptoms if you had some. So once again, if you're symptomatic, but you've not been tested and you typically don't have symptoms, then you have to remain home for at least 10 days from the onset of the first symptom. And you also have to be fever-free 72 hours without fever-reducing medication.
Okay.
And then if you have no symptoms, then that really isn't applicable on that second
And
row.
again, just to call it out for parents who are experienced, veteran parents, and dealing with kids who are in school, that's a difference too. In the past, we've said fever-free for 24 hours.
Correct.
This year, different situation.
Yeah, as recommended by the CDC and the Indiana State Department of
Absolutely.
Health. So once again, this is why we set up option B, remote learning, because we do know that we're going to have students in and out of our schools. This is not appropriate for virtual or for the
the
Virtual
Virtual
Academy,
Academy,
where it's
right.
at least a 9-week commitment on our elementary school and middle school students' part semester for the high school. This is for people that have to come in and out in terms of attendance because of COVID-related conditions. Okay.
And certainly, and I know we have seen questions like this before, we are going to continue to provide more information on that remote learning option because of the fact it's going to come up once the year starts. Right now, we've been really focused on getting a lot of information out about the Virtual Academy. So just to let people know, they're going to learn more about that.
It's also why we call them separate things. One is remote learning, specifically due to COVID-related symptoms, or you have to isolate.
Sure.
Virtual Academy, different scenario.
Correct.
So now we're looking at the third row. So you're tested and you're negative, but you have symptoms, okay? So you're symptomatic, but you've been tested and the test has come back negative. So if there is no alternative explanation, for instance, you are not typically suffering from allergies or things like that, then you have to isolate for 10 days from the first day of the symptom, once again, and then you also have to be fever-free for 72 hours without fever-reducing meds. Also, my understanding through various research outlets that the test can be not accurate for upwards of 35% of the time. So you could have COVID-19 and still have a negative test just because of the
And we have heard from
inaccuracies
health
of the
professionals about instances of that, unfortunately.
Correct. So I think that really covers it in a nutshell. I also know that in italics, in the bottom of that third row and in the middle portion of the third row, that they're, we're not IDOE, but the ISDH is strongly recommending the time-based strategy, which is the 10 days or the 14 days, which we'll get into a little bit. There's also a two-test strategy where you could have a negative test one day, wait for 24 hours, have another negative test the third day, but that's not really been found to be that reliable. So we are operating on the time-based strategies.
Okay.
So, and then still in the third row and looking at that, so you're tested and you're negative and you have no symptoms. Well, one might ask, so why is this even in here? Well, I think there are some people that perhaps want to be tested just to make certain. So if you don't have symptoms and you've been tested and it comes back as negative and you have no known contact, close contact with somebody that's tested positive, then you certainly may proceed with attending school.
Okay. And I think we've addressed this a bit, but I want to clarify again. So forgive me for asking again, Dr. Smith, but we do have several people that have weighed in on the fact, again, about if they have a student that deals with migraines, allergies, those type of things. We all know that kids have those issues, totally unrelated to COVID-19. Do you want to just address that again so we're clear on that?
Certainly. We understand that attendance is going to be an issue during the pandemic. We also understand that there are individuals that have allergies or migraines that could mimic the symptoms of COVID-19 without one having COVID-19.
Sure.
So that's why the guidance is, and our expectation as a school district is, then you will not have to be out of school for 10 days if you have a symptom that a healthcare professional can attribute to something other than COVID-19. Maybe another example is your child has a sore throat, has a fever, you take them into the physician, they get tested for strep, and they do have strep. Okay, so with that, you have to be fever-free for 72 hours still, but the 10-day isolation is not required. Basically, then, as long as you can provide the statement from the healthcare provider that you were symptomatic due to strep, you were tested positive for strep, you're fever-free for 72 hours, you may then return to school.
And I think someone just asked this question. I think it's a good one. Of course, we're still in a position now where we are 4 weeks out from the new announced start date of school. If this is the time that you need to take advantage of this time to get documentation from your child's physician, would be a great time to do that. For example, the allergies, they could get that now, could they not? So they're prepared.
Can. And then, as I alluded to earlier, it really then is upon the advice of the healthcare professional as to whether he or she would want to see your child when they become symptomatic. Okay. And then we're looking now at the fourth row of the Indiana State Department of Health's guidance, that chart. So now let's say the individual is tested and they're positive and they're symptomatic. So then you have to remain home in isolation for at least 10 days from the date the symptoms began, not the date of the test, but the date the symptoms began. And you also have to be fever-free 72 hours without fever-reducing medication. So that is if you're tested and you're positive and you're symptomatic. If you're asymptomatic, in other words, you have no symptoms, but you have a positive test, then you have to isolate 10 days at home from the date the test was taken. Okay? So I think it's important to know that. Now, say that you are asymptomatic when you had the test comes back positive, you're still asymptomatic for 2-3 days after that, but then you develop symptoms. Well, then if you develop symptoms, then the isolation starts day one that the symptoms appeared. Okay?
Okay.
Once again, this is all laid out in that chart.
And I want to, speaking of that chart that you're referencing, this is such great information, and it's really what's guiding our work and can be such a useful tool for parents. This is posted on our website in its entirety, the way you're displaying it on the screen. So we ask you to refer to this as a reference. This is a great way moving forward. If, unfortunately, you think there's a situation that could involve your family with this, go to our website, go to this documentation, and it really will help you take you through the steps of the process.
And once again, if you have concerns when school starts up, we're blessed to have outstanding healthcare professionals in each and every one of our schools, and they are there full time.
Yeah, that's a change from previous years.
If you have a question as a parent and you say, gee, I don't know what to do because my son is starting to cough, typically doesn't cough, what do I do? Call up one of our nurses, and they'll be able to walk you through this.
And I want to make sure people understand that we've always been blessed to have school nurses, but their hours didn't necessarily extend to the length of the student day. This year, we made that change because we felt like it was vitally important to have a school nurse in the building during the entire time that students are present, and so that's going to be the case in all EVSC schools. And
the board clearly knows how important that is. So once again, I'm grateful to the board for saying yes, nurses in our school full-time during this pandemic.
Well, we want our teachers and principals and other staff focusing on what's in their area of specialty, and we want healthcare professionals in the building answering medical questions.
I guarantee in the EVSC, healthcare professionals are going to be making this call.
Yes.
Yes. And then finally, in the last row, now this is different because now we're talking about close contact, and just to make certain that we're all clear on that definition, if you look at CDC, they don't use the term close contact, they use the term exposed. The Indiana State Department of Health uses close contact. We're talking about the same thing, but close contact is determined that if you are within 6 feet and for longer than 15 minutes with someone that has tested positive for COVID-19, okay?
And I think that might be a great time to interject this question that just came in, Dr. Smith, from Linda. So Linda asked, you're talking about social distancing, close contact.
Correct.
And Linda asked, if a child or a teacher would test positive, would all the children in that classroom have to be quarantined? And I think this is getting what you're talking about.
Absolutely.
With the distance.
So Linda, thank you for the question. I asked that specific question of the Vanderbilt County Health Department, and their response is no. If you have seating charts, and yes, we will have seating charts, and specifically in our elementary schools, we're keeping them in cohorts or in groups so that, God forbid, somebody does come down test positive, the whole classroom does not have to then self-isolate or
quarantine in that situation.
So what we would do is we would identify students that were in the proximity of that student, and we would contact the parents of those individuals. But frankly, if we have made certain that they are 6 feet apart, then there is not a need for those individuals to isolate.
I want to clarify, that's based on the guidance we have received from medical professionals.
As of today.
As of today. We know things are subject to change. And here in just a little bit, we're not going to do it yet, we're actually going to show some pictures that we have to display of some classrooms that are set up. So we'll hold that thought for a second before we get to that.
Very good. So once again, going back to the close content on that fifth row, it's not applicable if you're symptomatic, but if an individual becomes symptomatic, refer to the symptomatic scenarios that you have in the cells above row 5. Okay, so the individual, here's something that's a little different though. The individual must quarantine for 14 days after contact with a COVID-19 positive person, even if the student has an alternative diagnosis for symptoms. So say, for instance, that I have allergies in the fall and I'm coughing, sneezing, a little bit congested, but I've come in contact, and I can have a healthcare professional that says, well, you've got allergies. I don't think this is related to COVID-19. If you have come in close contact with somebody that's tested positive for COVID-19, you will still be required, according to the requirements and guidance from the Indiana State Department of Health, you will still have to isolate for 14 days. Okay?
So Stephanie asked a question that I know are on people's minds, and it goes right along with what you're talking about now. So how are siblings impacted in that situation?
Very good. If there is someone that has a positive test for COVID-19 in the family and children or siblings are in that household, if there is a positive test, or if the father, for instance, tests positive for COVID-19, then the children need to quarantine for 14 calendar days.
Okay.
Once again, I know that that's a hardship, but these are not our requirements. I appreciate the Department of Health putting this out. That's the expectation, and that will be the policy that we abide by. Once again, it's so important then that we have that remote option for students.
Definitely.
So that they can then transition from in-person learning to learning at home with that remote option. And then when everyone has lifted from quarantine, then they are able to come back
And
to
I
school.
can promise you teachers are spending a great deal of time planning ahead for these what-if scenarios, so they are in a position to provide that type of instruction should the need arise.
Yes. And then to finally finish on this page, and this is probably one of the most important pages.
Sure,
We'll
that's
spend
very
some time on
worthy
it.
of your time, definitely.
But so then finally, you've been in close contact and you're not symptomatic, you have to quarantine 14 days before returning to school. So hopefully you'll be symptom-free for all those 14 days. That's 14 calendar days once again. So hopefully there would be a couple weekends over there. So the actual school days missed would be no more than 10. But it's important that everybody understand that. So I hesitate to recap this because I know we want to move on and we already are half an hour in, but it's important that everyone understand this guidance from the Indiana State Department of Health.
And please go to our website to see it.
Right.
I'm going to ask you to pause for just a second, Dr. Smith, because I know we're getting ready to move into a very important part of our plan coming up. If you would, though, I've got a few people that have been patiently waiting for a couple of general questions dealing with reopening. So maybe this would be a good time to throw those out, and then we'll jump right back into the plan. So Mary got on right away at the beginning of the program at Facebook Live, and she wanted to know about orientations coming up to start the year. And it seems like we're hearing the most from two parents, two types of parents.
And freshmen.
And freshmen in high school. Funny that there's that
Sure.
big gap, but those are the parents that are the most worried, everyone's concerned,
Yes.
about orientation. You want to talk about that?
Very good, and thanks for the question, Mary. We will do virtual orientation for back to schools, but specifically for kindergartners and freshmen. I know how important it is for them to go in the building
Definitely.
and to see the physical structure. So for that, you can make appointments with your school. Please contact your school or email your school principal or whomever. The contact information.
And the
is
schools
out
are
there.
going to be
Right.
putting that information
Yes.
out as well,
Yes.
because we understand for those students, we've got to get them in the building, but we're going to do it in a safe manner.
Yes. So the parent will be able to go in with the kindergartner, and someone from the school will help guide them around and show them where they will be. High school freshmen, you'll probably do this in small groups, but I just ask.
Where we're socially distanced.
Right. I just ask that you give us a little bit of time with the high school groups because they still, with the freshmen, because they're still finalizing student schedules. As I think we've referenced several times before in previous podcasts or Facebook Live sessions, our high schools completely rescheduled their students so that
correct.
we could accomplish social distancing. And I think I've heard from numerous people now that they appreciate the fact that we're just not taking a cursory look and saying, yeah, we're going to attempt or we're going to encourage social distancing. No, we mean it.
Right.
We will have social distancing in our schools.
Right, right. No, you're exactly right. And again, back to the orientation topics and questions like that, you and I have had this conversation. The things we always deal with to start a school year, they didn't magically go away. We're very
Right.
attuned to those. We just have to figure out how to do them in a different environment now so that we can make sure everyone's everyone stays safe. So while we're spending a tremendous amount of focus on dealing with COVID-19 in this pandemic, we're still attuned to those things that need to take place to get our kids off to a great start.
And at the end of the day, it is the school. The school building is important, but at the end of the day, it's the teachers, the relationships, and all that inside the school building that matters so much. That's why we do understand kindergartners and freshmen will have the opportunity to
Absolutely.
tour the schools.
Let me throw two quick questions at you. They're not going to take long, and then we're going to go back to the plan. So Allie asked early on, what about after school daycare, before school daycare, our extended day program? Is that going to be in place?
Absolutely, it will. We'll skip that when we get to it a little bit later on, but those will still take place, and they will follow the guidelines put forward by Evsc, aligned to the state and Vanderbilt County guidelines.
Okay, and then one more. Kenny asked early on, we did a delay to the start of the school year. We adjusted that. Do you anticipate, he's asking, doing additional delays if the numbers don't come down? Would you consider 2 more weeks and 2 more weeks? If you had a crystal ball, how would you see that playing?
If I had a crystal ball, I probably wouldn't be sitting here. No, and Kenny, that's something that we continue to process. But actually, Jason, make sure I come back to that, because I think maybe it will be made a little bit more clear if we go into the next
Definitely,
segment
we'll do
here.
that. And I know that's a question on a lot of people's minds.
Absolutely.
So let's go back in now and take a look at the plan. We'll put this back up on the screen and lead us through it, if you would.
Yeah, so now we're actually on page 8 of our book. If you're following along, and if you joined us a little bit later, I encourage you to go to evscschools.com and you can open up our reopening plan. So now we're looking at the operating levels. So I wanted to make certain that we were basing our decisions on sound data. So I also wanted to make certain that we could develop something that would help our public understand our thought process. So if you look at page 8, you see 3 different operating levels. The green level, the risk of spreading COVID-19 to others, is low, so schools are open, curriculum's delivered. You can read that there. Green level basically means go. Yellow, on that level, yellow, well, now that's a little bit different, okay? And there is not a simple, clear, concise definition I can give you, so I want to give you just a few scenarios or examples. It could be that based upon a particular zip codes, that we have some schools that are being hit exceptionally hard. So it could be that we would close a few schools in particular zip code if their absenteeism rate is exceedingly high, or if the positive COVID cases in that particular region of our city or county are very high.
And I'm glad you specified that, because that's a change. People are used to winter weather, and Vandenberg County, it snows, all schools do the same thing. It could be different this year.
I will tell you one thing, there is not anything that is all or nothing, and there's not a one-size-fits-all in this plan. So we want to tailor it to the specific needs of the individual, to the specific needs of the class, or to the school. So there could also be, and this is really getting a little bit more at Kenny's question, so if we continue to analyze, when we continue to analyze the data, and we see that things are not slowing down or abating at all, then we could deploy the strategy of having half of the alphabet come in, not for just 3 days, but for maybe a week or some variation of that. I know how important it is for teachers to set the groundwork from day one. Mm-hmm. Yes, we have invested millions of dollars in technology, and we can go virtually with a high degree of confidence, knowing that it will not be like we had happen last spring. We are so much better now than what we were before. That took, I think, everybody surprised. Well, we've had 5 months to plan, and I assure you, we've planned and we put many things in place. But I really do not want to start off virtually if we can help it at all, because it's so important for teachers to create that relationship with their students and set those expectations. So that would just be if we're in level yellow. Another variation, we could have our students start just half of our student population at a time, as we've already laid out, and then continue to do an analysis of the data.
And I think what I hear you saying is all options are on the table.
All options
we will
are
consider
on the table.
all options at any point.
Right. Including the fact that our elementary kids, while virtual option is good, it's more challenging for kids in elementary grades, specifically in primary grades. So there could be a scenario where they would be in attendance every day, and we would go virtual for kids in middle school up through high school as a way to continue to spread social distancing. And then finally, in level red, that is where the spread of COVID and the risk of spreading is so significant that all schools will be closed to in-person learning. While we experienced that last spring, as I said, it will be a different virtual experience for our students should we need to do that again.
Sure.
Okay.
And I think all that makes sense, and I think it's going to be even more clear with what you're getting ready to go to now, because this is going to really help people to see where we're at.
So the next page, page 9 of the booklet, I think has a level of specificity that I hope will provide some comfort to our parents. First of all, I want to draw your attention to the right of level green, where it says, based on considerations below, the EVSC will implement a plan of action based upon current conditions in Vanderbilt County. I don't want folks to just look at this and say, hey, there are 360 active cases, so we're moving from green to yellow, okay? But I'll tell you what, let me back up in my haste here. I want to set the stage a little bit. We have approximately 180,000 residents in Vanderbilt County. So what we've done is we've taken what 1% of that would look like, and then we've stratified that. If 0% of 1%, so if we have 0 active cases, which Dr. Box basically said, well, that's not going to happen for quite some time, then we would be in level green from that up through, well, when we're approaching 20% in terms of active cases, then we need to do a deeper dive. So where are these cases coming from? Is it, when we look at the positivity rate, which is also something that we would take into consideration. So let me direct your attention.
And I want to make this clear as you're going through this, Dr. Smith. This is county-wide data for Vanderbilt County. I don't want anyone to look at this and think, oh, this is just in our EVSC schools.
No.
And that really speaks to what you have been imploring all along. This is a community-wide issue. We all have to work together because that's where these numbers are coming from.
So when you look at the bolded box that says considerations, in addition to the active cases, we will look at the positivity percentage, not just the daily positivity percentage, but also a rolling rate of 7 days and 14 days. We'll also look at the average daily number of hospitalizations and then the average daily number of patients in the ICU. I think folks that have done some research with the pandemic understand that these roll through in phases. So when you have active cases that have an uptick, then what follows typically in 14 days or thereabouts would be an uptick in the number of hospitalizations, and then unfortunately another uptick in those that are in ICU as well as those needing vents. So we will take all of this information into consideration. So it's not just the 360 active cases. When I look today, we're at 421 in Vanderbilt County. We'll take that into consideration along as the positivity rate and how all of that works. And then we'll continue to consult with our healthcare professionals. That is incredibly important. I just wanted to make certain that the public would understand, okay, so EVSC, how are you making these decisions? Every school district should be doing something like this. And we just want to put it out there. So this is what we're attentive to. This is what we're looking at so that we can make the best informed decision that we possibly can, understanding that when we are in school, it will be making certain that we do that frequent thorough hand washing, making certain that we have social distancing in place, wearing masks, as well as making certain that we have that thorough and deep disinfecting and sanitizing.
A couple of things I want to point out on that. Of course, we are going to update that for our purposes, and we're going to have that posted on the EVSC website as well. When you click on reopening, it's going to take you to this reopening plan. You're also going to see an option to see this graphic. We're going to update it on a daily basis, just like the health department does. So someone just asked, in fact, Jessica asked about where you can get this information. We're getting it from not only the state, but from the local health department as well. And then we will update that. And that is what, as you said, will help to guide us on our decision making. And of course, we're going to continue to stay in extremely close contact with health professionals.
Yes. So Jessica, I mean, this is no secret. The Indiana State Department of Health has a very good website. If you go on that, click on the state of Indiana, Vanderbilt County, then it will basically filter everything out, and then you can see a great deal of data.
It's an interactive map. You can actually click on any county you wish, if you have family, that type of thing, and see exactly what the up-to-date information is.
The Indiana State Department of Health updates theirs, I think, at 11 o'clock, I believe, our time.
I believe.
And then Vanderbilt County will update theirs. So there is typically a lag time, and we're going to update our information at 7 a.m. every morning.
And we're also going to post on that, we will have included when the most recent update was. So
Right.
we'll keep it updated, but when you look at that graphic on the website, you'll be able to see when the health department posted this most recent information, so you know you're looking at something current.
Once again, I'm a parent. I understand during a pandemic that people can be anxious. What I want to do is help everybody. I want to kind of pull the curtain back and let everybody see these are how we make decisions.
There's no secrets.
There
in
are
this
no
time.
secrets whatsoever. I know it's taken us a while to get to this level of specificity, but I hope it provides some comfort for everybody in Vanderbilt County knowing that this is how intentional and how focused we are on this.
A couple of things. Let me interject, and then I want to throw a question at you that is about this. We are getting a lot of questions about masks. Just hold that thought. You're going to come to that because
Yes, I
we've got
will.
some specifics in this, so that's coming up soon. We've also had questions about, again, we referenced it earlier, an example of what a classroom will look like. Here in just a little bit, we're going to put up a brief slideshow where we're going to show some pictures. So stay tuned for those. And then Gail asked a question. Does the Evsc Virtual Academy, and again, that's the program you would commit to, either a grading period, 9 weeks for K-8 or a semester for high school, will they follow these guidelines, these operating levels? Great
Thank you,
question.
Gail. Great question, and I meant to mention that earlier. Once we start on August the 19th, Virtual Academy will start the same day we start, and then they really are not impacted by the 3 levels. Once we start school, they will go on unabated until they fulfill the 180-day requirement.
Right. And so for someone considering Virtual Academy, the EVSC Virtual Academy, that is something to keep in mind, that program will then run consistently. If that's a factor for you and your family, then that's definitely something you'll want to think about.
Very good. So thank you for that question, Gail. So then moving on to page 10, specifically in the academic plan, you can see in the green level, we're going to continue with the 3 learning options, which I'll talk about in just a moment, but which you've heard quite a bit about. The yellow level, I mentioned a little bit about what that could look like from an academic perspective earlier, and then the red level, schools are closed to in-person learning. So then looking at page 11, specifically with the green level, we've discussed these 3 bullets since June. We have EVSC learning at school. We also have the temporary remote learning, and I've talked about that quite a bit when I was referring to page 7 in the State Department of Health and what they said students and kids needed to do if they were symptomatic, asymptomatic, positive test, negative test, or close contact. So that remote learning, if they have to miss school due to a COVID-related issue and it's on a temporary basis, then people will go automatically into that remote learning. And then when we look at the EVSC Virtual Academy, which is a school at home, that's a phenomenal virtual academy that's been with us now for more than a decade.
Right.
And individuals had the opportunity to select that also.
And again, I do want to stress, too, for the EVSC Virtual Academy, one of the advantages of that compared to maybe some is you really have a connection with teachers. We've always had a staff devoted there. We may be having to move additional staff there for capacity, and they will really be able to stay in contact with families to provide the support kids need.
And I appreciate you saying that because, frankly, virtual academies have gotten a bad rap in the last few years.
You're right. That's a good point.
Quite frankly, some individuals that were more concerned about money than educating kids. Some of those virtual academies still exist today, unfortunately, interstate. I will assure you that the EVSC Virtual Academy is second to none. Second to none. And if you want a quality education in the virtual realm, EVSC Virtual Academy is where you should be.
Definitely agree with that.
Next, the yellow, level yellow. And I've really talked about this before, about 10, 15 minutes ago. But this is our way of being as nimble and responsive as we can if there is a certain segment of the county that's experiencing a rather high rate due to whatever happened in that part of the county. And it can be traced to a source, then we would not close the entire school district. We would just close the schools that were being heavily impacted by that.
Let me stop and ask you this question, and you've mentioned it, Dr. Smith, but to clarify, we're talking a lot about whether it's remote learning or EVSC Virtual Academy. So Rachel asked this question, but others have asked it as well too. Can you talk to us about computers, technology for students
Sure.
to make them successful in this situation? And let's think of the entire spectrum, K-12, if you would.
Absolutely, and it's a great lead-in actually to Level Red. So if we could be on page 12
Sure.
here. When we look at virtual learning, the first bullet for the 2021 school year, all K-12 students will have a device to take home. So we've made certain that every student will have a device to take home, as well as we've upgraded our internet access. We also have put in for a grant that will help us provide hotspots for those individuals that don't have them. As you know, everybody is trying to purchase hotspots at this point in time, so that may be delayed a little bit from the start of school, but we do have other mechanisms in place. We will have 20 or 21 buses loaded with internet, so we will also do basically a density map of where we have pockets of absence of internet within our community, so we can take our buses and park them in a location, perhaps in an apartment complex where there's absence of internet connectivity, and then students will be able to access the internet there.
And schools would announce that time, too. They would say there's going to be a bus with Wi-Fi access parked here on this date, these times, and then families would know that kids could go there to get onto the internet.
As well as we've adjusted the bandwidth within our school so that the internet actually goes and penetrates the wall so that it's available in our parking lots now. So individuals could go download content if they needed to, and then go home, do the work, and then come back and submit the assignments. So we appreciate what everyone has done to help us. Also want to reiterate that during the start of the pandemic, we had a shelter in place. Everybody stayed at home. So that meant that the library and other places where you used to be able to go to connect to the internet were also closed. If that happens again, we've made some arrangements, and then as the equipment does come in, then we'll have that for everyone. But in the intervening time, the start may not be great, and we apologize for that. We've tried to get equipment. Some of this, we've gotten some of it in. Some of it still is slightly
Lots of
delayed.
demand right now for that type of
Incredible
equipment.
demand.
And I guess that what we really want people to know is exactly what you're saying. We realize that for kids to be successful in a virtual environment, they have to have not only computers, they have to have internet access.
Right.
And please know we've spent the last 5 months doing everything possible to plan ahead so that we're in a good position
Absolutely.
should that scenario repeat itself.
So one of the common scenarios is that, students didn't have one device from school, but they had a device at home. Well, if the parents were working remotely and then you had several kids that need that device, that was problematic. Every student will be able to have a take-home device from Evsc, and there will be internet access.
Okay.
I hope that answers.
That does. No. Please, I have a couple of quick
questions,
questions, but
yes.
keep going, then I'm going to throw those
Well,
out here in a second.
and also you can see that we'll use the Google Slides or Google Classroom for the jumping off platform, so everybody will know where to go to access. Then it may take them to different sites depending upon how the teacher has designed the lesson plans, but everybody will have that commonality in terms of Google Slides or Google Classroom.
Okay, I'm going to let you take a drink for a second with you doing this talk, and I'm going to just answer a couple of quick things here that I know people are asking about innovative model programs.
Yes.
Those will continue.
They
So
will.
I know those are very popular. They're tremendous programs. They will continue. So please know that. We've had some people asking here more about when to expect the individual school plans.
By
Those
the end of this
websites
week.
will go live this week. And again, if you're looking for specifics about your child's school, Oak Hill, Vogel North, whatever it is, that's where you'll find that.
And we'll show an example toward the end.
And we're going to show an example here. And then also some people ask about, several have asked about an updated school calendar to reflect
Yes.
changes. And we hope to be able to share that maybe in about a week, possibly.
Yes, I think we should have it ready at least for a presentation to the board Monday.
Okay, it won't be tonight in this,
Right.
but of course everyone knows we had 10 days, so we'll have to take those into account to kind of redo the school
Yes.
calendar, and next week they should have that. Okay.
Yep, thank
You've
you.
had your drink, so now it's time to go back in.
Okay, and then the next bullet down, the fourth bullet down is, I think fundamentally will show our audience that we have grown and we have definitely improved. Your child's teacher will provide synchronous. That means real-time instruction daily.
Give me an example of that. I mean,
So if in my schedule I'm scheduled to take algebra at 10 o'clock and I'm a high school student, well, then your high school teacher at 10 o'clock will, the expectation is for 30 minutes, be available to you to deliver instruction, to talk about the lesson, to be able to answer your questions, to problem solve with students through our virtual platforms.
You're basically participating in the class, just not sitting in the physical classroom.
Right. So we have the means to do that, and I know that's a push for some teachers, but I also appreciate the fact that they've taken time this summer to avail themselves of the tremendous amount of resources that have been available to them to learn how to do that. And I know the vast majority of them already knew how to do that. We also know that works better for high school than it does for middle school, and then for elementary schools. Elementary school is going to communicate specific schedules with that daily core instruction. I also know that it's difficult to have a first grader sit behind a screen for 30 minutes of instruction at a time. So we will adapt that to where it's age and developmentally appropriate. But that is a huge difference and distinction from what we had before. It will be synchronous learning. So it's important that our families understand that.
Okay.
Attendance then will be taken daily based upon participation in that synchronous class, as well as demonstration of evidence of learning. And then clearly our special ed folks are phenomenal, and as well as our EL teachers, and they're going to work with gen ed teachers to provide the additional supports.
And a lot of that information, of course, will be shared on an individual basis with those students and their families.
Yeah. And then I think this is what Gail was asking earlier, the Evc Virtual Academy will continue as normal.
Okay, and someone just asked this, Angela, so I'll go ahead and address this. If you're interested in the Evsc Virtual Academy, you can go to their website. You can get to that by going to the Evsc website, go to the Virtual Academy website. You can see all kinds of information. We've done a couple of videos, a podcast. I had a conversation with Stacy Heron, the director there. She knows it backwards and forwards. You can get a lot of information from that, and then you can actually click to move forward on the enrollment process, and they'll be in contact with you, and they're happy to answer any questions anytime.
Yes. Thank you for that. So now moving forward, we're on page 13, and considering that we're close to being an hour into this, I will not read to you, but I just want to lift a few things in some of the subsequent pages here. First of all, we understand that educating the whole child is very, very important, and it's never been more important than during the pandemic. So specifically, we have extensive skill sets in making certain that when social emotional learning, when you're looking at the last 3 bullets of that page, that we're very attentive to that and have specific plans for our K students. Mental wellness is incredibly important also, and we have developed specific plans to make certain that we can address the mental wellness of our students, and then certainly student support services. When we think about trauma or dealing with the anxiety or emotional challenges that people have with this, we have supports for your child, and more robust supports than any school district I've seen in this nation.
And we certainly understand the importance of this in any normal year. We've been committed to this for quite some time, but we definitely have not lost sight of the fact that kids have been out of school for 5 months. They haven't had that level of social interaction. There could be some anxiety, of course, with hearing and seeing this on the news, so we've got things in place to address that. We're very aware of that.
And then just to lift a few other things before we move on, certainly during level yellow and red, special education supports are going to include occupational and physical and speech therapy, either in person or through our virtual or remote therapy approach. And our psychologists, which are great, they're going to continue to support students based on their need at all levels. Okay. So then moving on then to page 14, in the academic plan for the reopening. This is in process of being translated into Spanish. We also have the ability through talking points in Google Classroom that have certain translation features. So we will get this translated in Spanish and then also up on our website. But you also see the plans for those specific kiddos that have either English as a second language or other things. I just want to lift and highlight English language development services are going to continue for our English language learners, and then individual learning plans are going to be continued to be written to reflect how EL students are gaining access to our core content.
Well, and
so
I
those
think,
things remain unabated.
Yeah, I mean, I think the challenge for all school districts, and we're very aware of it, and we're going to make sure it happens, is we still are going to meet the needs of all of our students, and especially those who may have some special needs as well.
So then moving on to page 15, already addressed before and after school daycare, they will be following Evsc guidelines, athletics, extracurricular, co-curricular, certainly following the state sanctioning bodies, if you will, following any
For
high
example,
school.
the IHS,
Right.
AA, yeah.
Yes, and we're blessed to have Andy Owen, phenomenal individual that oversees all of our athletics, and he's been in constant contact with our athletic directors, phenomenal, as well as our coaches. The football practice and other athletic practices have gone off without a hitch. I think that is a testament and should assure parents at home that we are taking this seriously and we do know how to put protocols and processes.
And I think we
in
have
place.
8 fall sports that operate, and really it has been phenomenal so far how things have gone. And I think you're right, a testament not only to the coaches and the athletic directors, but to the student athletes themselves.
Right.
I think it's really shown that kids, these are older students, of course, but student athletes can definitely learn what needs to take place.
And I think, and I've heard this stated many times, they know their season can end tomorrow.
That's right.
So I think that's why they are taking
motivation
things
is
very, very
there.
seriously. Absolutely. I want to spend just a few moments on visitors because this is different and what we
Yes.
have not experienced yet. So the first bullet, until further notice, visitors will not be allowed to eat lunch with their students or provide volunteer services at school. So no popping popcorn or things like that. I know that that is incredibly important, not only to the volunteers, but also
And
our
it pains us to say this type
It
of
does,
thing.
but during this time, that is being suspended.
And that's coming from guidance from health officials who, of course, if you can limit people coming into the building, hopefully that can help reduce the chance of positive
Fourth
cases.
bullet down, if parents need to drop off supplies, then they're going to leave the items by the front office. They won't be buzzed all the way in through the second door.
And individual schools are going to have systems in place for that.
Right. So just make yourselves aware of those if you intend, or if you wanted to visit the schools, or if you have to drop something off, it's going to look differently than it did last year. Once again, individual school sites will have more definitive information.
And we
on
look
that.
forward to the day where we can once again welcome visitors back into our buildings like normal.
Absolutely. And then finally, recess. Yes, there will be recess for our elementary kiddos. Yes, it's very, very important. They will have some assigned areas of play outside. Once again, we want to keep them in cohorts if we have to go back and do contact tracing. And then also, fortunately, it's easy to socially distance outside. I also understand that sometimes people want to be in closer proximity during games, but there are things that we can do to still have students engage in that physical activity while still keeping them socially distanced. And we certainly want to have them do that within their groups.
And I'm going to throw out an answer quickly. You said social distance made me think of this. Trent asked this question. Some others have asked this as well. In this, I think you're going to see more specifics in these school-specific websites.
Yes.
Questions about social distancing during drop-off and pickup. Of course, we know those are opportunities for large groups of students to gather.
Right.
So schools are certainly thinking that out. There's nothing we could really talk about with 40 schools in this forum, but you're going to hear about that from your individual school.
Well, and I'll tell people also that they may not be totally fleshed out by the end of this week because we're going
That is
through
true.
them on a case-by-case basis. Imagine, and I appreciate the parents that are now taking their kids to school and picking them up, and we'll address that a little bit more in a few minutes. But we will have specific plans because we will have more car riders than we've had in the past.
We definitely will.
And there are some of our schools that were built when the county had not grown up around them. So all of our buildings are landlocked, some more than others. So we will definitely look at that and put things in place and communicate then school-specific information from the schools to our parents.
And just like we've said, we'll continue to add and make adjustments. When these school-specific sites go live, don't think that they won't be adding additional information as they continue to process every possible scenario.
Correct. So now we're on page 16. Want to go over some of this, some in more detail than others. So once again, big bullet, and what we spent a great deal of time on earlier, parents should self-screen their students at home prior to coming to school. Once again, if your child does not have a fever of greater than 100.0, if you have signs of illness, the 11 that are COVID specific, or if you are in close contact, which means within 6 feet for more than 15 minutes, if you answer yes to any of those, then your child needs to stay home. Contact your healthcare provider, contact the school. But it's important to self-screen. I think some people have asked, well, are you going to take the child's temperature at school? Or are you going to, and actually we're following the guidance of Dr. Box, and she said, no, have your parents self-screen their students at home. And there are a variety of of well-reasoned reasons for that. Sorry about that, but that is the advice of Dr. Box and others. Students and staff are expected to wear a mask whenever social distancing is not possible. I know that there were several questions
Lots of
about
questions
masks,
about that.
and I'll get into that a little with greater specificity. So just hang
Okay.
on to your questions, and if I haven't answered them when I deal specifically with masks, then come
Fair
back
enough.
to us. And then classrooms. Students will be social distanced, and all student desks will face the same way. So if you could pull some pictures up, I want to go over this.
Yeah, let's
with
take a
the
look. Those
public.
are on the screen right now, Doctor.
So this is a media center, so it's how we're going to utilize our large spaces differently. You can see all the desks are there, certainly socially distanced 6 feet apart. There's another angle of that.
And that
That's
was a
media
great
center.
example of a media center that in any other year would have been the school library. This year, we may have
And
to
that
use
is
those.
that is an EVSC media center.
Okay.
So it looks like Perry Heights. Yeah. And then once again, this is an example of a classroom, different perhaps type of desk than what you would be accustomed to seeing. You can tell by the angles that they would typically be put together. Now they're being separated for the 6 feet social distancing, all facing the same way. This is an example of another classroom with the desk 6 feet apart. And then this is an example of, that looks like Perry Heights cafeteria. And if we hold classes in there, what it would look like are when students eat in the cafeteria, maintaining that social
And
distance.
we've said this before, but a team of individuals have gone through every single school facility. I know you always say, what is it, 5 million square
5.1
feet?
million square feet.
5.1 million square feet. We're going to use every possible space for learning spaces this year so to make this happen.
Yes.
And you may be looking at these pictures too, saying in a normal year, you're talking about collaborating and students sitting clustered together. Not this year.
Right. But actually coming out from our Office of Academic Affairs to our teachers, and we can certainly make this portion public, there are examples of how you can still accomplish group work, but what that looks like.
In a different format.
This particular picture that folks are viewing now shows desks that are actually facing each other, but it's important. If you look at the desk to the lower left-hand corner, that would be facing the teacher. Then in the next roll over, you're going to see a desk and a chair facing toward the back of the room with an opposing desk abutted to it that faces the front of the room. That's simply because we don't need these desks for other learning areas, and we don't have a place to store them. So we are actually forcing social distancing
Right.
by putting in place barriers for students to get closer to one another.
So if you're looking at that picture, you would not see a student in every single seat.
Correct.
Every other seat
Right.
would be left empty for them to store their things on that type of thing.
Absolutely. So we just wanted to give examples of what our classrooms look like for the public.
And a lot of people have asked about that, so I think people will
Right.
appreciate seeing these. And please know that the rest of our rooms, if they're not ready yet, because they're still going through some of their summer deep cleaning, this is what they will look like when we're able to resume school.
And we have 1,500 classrooms. We could have, and I know that we have literally hundreds of pictures of our classrooms, but in the interest of time, we selected those because we thought it was the most emblematic.
Sure.
Moving on to the next bullet on page 16, students will wear face masks on school buses. They will have assigned seating.
Without a doubt. they
More
will.
information about that in a few minutes. Only essential visitors will be allowed in school. So some of this is now starting to be a repeat of what we've had. Athletics, extracurricular, co-curricular will be conducted in accordance with the guidance from those governing bodies. Water fountains, we've not addressed this. They will only be used to fill water bottles. We do have now they were delivered to where we will have 2 water bottle filling stations in every school, so they're touchless, so students can just take their water bottle up to it, don't have to touch anything, and it will fill it with water. So
And I think that's going to beg the question from some parents, so is it okay if my child brings a water bottle?
Absolutely. Absolutely. It is okay.
Thanks for
and it
clarifying
is-
that.
We hope that individuals will.
Okay.
Big one, students are asked not to share belongings or supplies. I know teachers have made plans for how to navigate that, or related arts teachers or art teachers, because typically we do share a lot of supplies. We'll create activities where that is no longer the case during the pandemic. And then an important bullet, 2 from the bottom, EVSC, in collaboration with our partners at the Vanderbilt County Health Department, are going to be hosting on-site immunization clinics at schools. More information about that will be forthcoming from EVSC. Okay. And then the final bullet on that page is very, very important. and I've gone over this, but want to reiterate, any student experiencing symptoms of COVID-19 should be excluded from school and presumed to have COVID-19 until that student presents written documentation from a healthcare provider stating an alternate diagnosis and provider's belief it's appropriate for the student to return to school. Without that documentation, we've already talked about the 10 calendar days and the 14 calendar days. But I want to put up a flow chart, or I think something that will be very interesting for the public
And
to
that's
see.
up on the screen right now. Yeah.
Right.
What are we looking at here?
It's really how we will process positive cases of COVID-19 or either close contact. So I know that's very small print. This is still
And
a
it's
work
really
in
not
progress.
for parents necessarily to
Right.
follow. This is to show them what we're following.
Absolutely. But this is very important. I think that people understand that we do have a rapid response process map for COVID-19. We're prepared. All of this is not work that you can do when students come to school for the first time. This is work that has to be done prior to. We're processing this, and we're using this as our athletes have returned and marching bands have returned. It is working very well. We continue to have further iterations of this. We're learning organizations, and we continue to improve. I just wanted to have the public to have some assurance that we do understand how to deal with this. Also, that is not something that we have found anywhere. We've not been able to take it from somewhere else and tailor it to our needs. That's something that we've crafted in consultation with our folks, with the health department, and it is a tool that we will use when school opens.
And I think it's important to know we've developed that because we're playing out those what if scenarios, and we're realistic, and we know what if someone tests positive. We need to have a system in place so that we're not just making decisions on the fly, so to
Absolutely.
speak.
And then, not to go too much in detail with that, but then there will be automatic notifications for nurse. I would think that the nurse probably would be the one filling that out in many instances, but also with our custodians and our supportive service staff. So it has automatic
cleaning,
notifications, so we know what needs to take place and how it needs to
Sure.
transpire. So then on page 17 is once again a recap that is in a slightly different format, but this is once again taken from the Indiana State Department of Health. Once again, those 4 questions for screening your students are there in an easy to access location. When we look at page 18, now this is going to be mask specific, so we'll answer all the questions hopefully that people have. And parents, before I dig into this, I'm just saying, hey, I need your help, especially with the young ones. You know, I was out because I had to go to a few places this weekend, and I was very, very encouraged by what I saw. Unlike the previous weekend, where at some locations, less than 50% of individuals were wearing masks, I think it's a very, very safe bet that at least 98% of the individuals that I saw, and we're talking big box stores,
Sure.
as well as some other stores, they were wearing masks. And as I said last Friday at the news conference, and we stated again today, our reopening is going to be successful only if the community is adherent to those precautionary measures that they have to take, one of which are wearing masks. So when we look at face coverings, and I will tell you that if you want to get a good, robust conversation going, you talk to anybody about face masks, and a lot of people have opinions about this. My opinion is I understand personal rights. I also understand personal responsibility. And frankly, I think we all have a responsibility to one another. If you choose to go out and you cannot socially distance from one another, then I think you have a personal responsibility to keep yourself as well as the loved ones that you have that may be at risk of getting COVID-19. You're doing this to protect them. This isn't about being macho or about being weak. This is about taking the steps necessary to try to contain a pandemic during the time of a pandemic. So we are strongly encouraging individuals in our school to wear a mask where you cannot socially distance. Our kids are able to wear a mask 100% of the time at school if they choose. We do have our classrooms set up to where we can meet the requirements of social distancing. If they want to wear a mask during or in class, they may certainly do that. We are expecting and strongly encouraging students to wear a mask in the hallway. Why? While you're not going to be with someone for 15 minutes, but the amount of droplets, respiratory droplets that are in the hallway at that time because of density would be greater. So it just makes sense to be able to wear a mask to protect you and specifically to protect others.
And again, we're doing these things to help keep people as safe as possible, and because we want schools to be able to reopen and stay open. And we've got to put every single protocol in place to try to increase the odds that that's going to happen.
And this isn't David Smith talking about the importance of masks. Everything I'm saying, you can go out and find research that validates that masks are an important deterrent. I do understand that early on, masks were not recommended. And that could have been in part for two reasons. First of all, I don't think that there was research present at the time that spoke of the efficacy of wearing a mask. And secondly, there was a shortage, at least people were indicating that there was a shortage of masks, and they wanted those masks to go to healthcare workers, those frontline workers. I think things have changed a little bit. We've had research out there now, so masks have been proven to be a good protector for you and or for others. And N95 masks have been determined to be a good protector for you.
And while you're talking about that, and you're talking about masking, you just made the comment, David, about the hallways. So we just had two questions that came in. Both Jaden and Amanda asked similar questions, and that is, are we switching classes this year, moving from one room to another? And they're basically, whether it's high school or some of the other levels. So you want to just comment on that?
So as you go up further in grade level, the probability that you will be switching classes is greater. High school students will switch classes. Most middle school students will switch classes. The majority of our elementary school students will stay in a class, and we will rotate teachers or others in. Now, that's not a 100% accurate statement across the board because we're taking that in consideration and balancing that with other facets that are in each individual schools. But by and large, our high school students, because of the very nature of the requirements that they have for earning credits, then that really necessitates them moving room to room.
And since you're mentioning that, let me go ahead and ask you this, and I didn't see necessarily someone ask it right now, but this is a comment or a question we received on social media in the days leading up to this. Could you talk for just a second about the decision in high schools? Why have we said we're going from the block scheduling that we've been doing now for several years back to the traditional schedule? You want to comment on that?
So in order to accomplish social distancing, you basically have to spread more students out over more opportunity. So the way that you decrease class size basically is to have more classes. So that's in essence what we're doing. So we are having more classes throughout the day so that we can have our class sizes smaller. I will also tell you that we are utilizing some of our larger spaces, such as an auditorium, for a forum type of instruction. So an auditorium that has a capacity for 1,000 students or 1,000 individual, we may have 100 students in there or 118 students in there, but they will be socially distanced. But that is so that we will be able to make certain that our teachers have adequate time to plan, so that our teachers have smaller classrooms elsewhere. And the whole point is to be able to spread people out so that they're not congested. Our auditoriums, if you think of Central High School, have 4 or 6,
maybe 6,
3 different door stations across the front, and then 1 in the back. So actually, they will be able to socially distance the students as they enter, as they exit, and as they are in there.
And I want to clarify, too, what you said. You're exactly right, but I don't want people to think every day, all day, their students going to be in a class of 118.
No.
I just want to make sure people didn't hear you say that.
No, but that is one way that we utilize our bigger spaces so that our classrooms then can have smaller students or smaller classes.
And maybe we should have stressed that more when we had the pictures up of the classrooms. And Derek asked this question, and it's a good one just to clarify. Again, as you're saying, to socially distance, we have to have smaller classrooms,
class
sizes,
yes,
so we can spread the students out further. So the question, does that mean smaller class sizes will be in existence or will be present? Yes, they will.
Absolutely.
And we're doing changes to the schedule to make that happen.
Correct.
Okay, and using I think the two ways that's happening, changing the schedule and using learning spaces that typically maybe aren't used for learning or classroom spaces.
Fundamentally, those are the two approaches to social distancing that we employ, because right out of the gate, we determined if we could do that, that was a better option for our families than going every other day the entire year. Because I know that puts a tremendous strain on families whose parents have to work outside the home. So once again, all of this is in a decision matrix. So if we do this, then we have to do this. So, I mean, it's a yes-no kind of decision tree for every decision that we're making based upon solid facts.
And before you keep moving through there, you've already talked about this, so I would just want to interject it to make sure, because we've had some ongoing questions about this. Please know if you have a special needs student, a student who receives special education services, they have an IEP, we will meet their individual needs. Nicole Alcorn is our Director of Exceptional Learners. She and her team have been working tirelessly. They've been making contacts, so either they or schools will be reaching out. That teacher of record will be a vital team player, as they always are. So please know we will meet the individual needs of your kids, just as we always have been. And if case conferences need to be pulled together, that will happen.
And I appreciate you making that important distinction. Again, we do have students with medical needs that are students that are autistic, where wearing a mask would be very problematic for them. We also have shields.
Face shields.
Shields. So there are other things that we will continue to work with students and work with our families. We understand that. Once again, we're not at a 30,000 foot view. We may be at a 15,000 foot view as we continue to get lower and lower to exactly what it looks like. But we do understand that we need to be flexible enough to meet the needs of all of our students. I want to quickly go over the face coverings. It's delineated there in bullets, but should clearly cover the nose and mouth and be secured, fit snugly, comfortably against the side of the face. These are things I think are pretty commonly known. If a cloth mask, please wash it regularly and thoroughly. Include multiple layers of fabric. Allow for breathing without restriction, and very, very important that people may not have thought of before, it does need to align to the dress code. So once again,
no scary masks.
Right. You can get masks that scare people. That's not what we're doing.
That's not what we're wearing.
Where basically they should be either a plain collar, one collar, or if schools, and I think some schools have done this, they've purchased masks with the school emblem.
Yeah, and you may see more of that.
Right.
The longer this goes, you may see
Right.
schools that are doing that just to try to have school spirit in kind of a different time.
And once again, I'm pretty pragmatic. I think I understand that masks can be challenging and problematic, but once again, I'm imploring everyone to help us with this. This is a time where I think our community could pull together and we could be a shining example of what communities can do when they're working in the best interest of our students. And once again, parents, help your young ones, because I was amazed that I saw very, very, very young children that were wearing masks this weekend.
Definitely.
I understand that has to be built up.
And again, as a parent, we want our kids in school, so we're going to have to do what it takes to
Yes.
try to increase that.
Yes. So then when we look at page 19, once again, that's another way for us to just recap what those healthy behaviors are. Excuse me. So that, and there are pictures that you can show your younger kiddos that may help them understand that. On page 20, health and safety plans. And we've gone over a lot of this, but if a student gets ill at school, I want to stress, once again, we have a nurse in every one of our buildings, so if a child is ill, they're not going to be sent down to see the principal or the secretary. God knows they are phenomenally great people, but we're making our decisions based upon the advice of healthcare professionals. So you're going to send your child, or the teacher would send your child down to a healthcare professional who's going to triage that student, and then they will make the appropriate moves. It could be isolating the students from others. All of our schools will have isolation rooms for the purpose of isolating someone that is symptomatic or could have symptoms of COVID-19. The nurse is going to notify the family, and then depending upon what the Vanderbilt County Health Department says, we'll notify any relevant classmates for that contact tracing. Then schools will disinfect the nurse's office and other areas, and then any students going to be sent home with a fever should remain home. We've covered this, fever-free for 72 hours without fever-reducing.
And just before you said that, Carla had submitted a question about contact tracing. Certainly, so much of the protocols we put in place is to help, too, if the need arises for that, we're going to be in a much better position to work with the county health department on contact
So,
tracing.
you know, that rapid response flow chart,
Yes.
that's just part of the equation. We also have individuals that have been trained with contact tracing and what that looks like. So we'll be able to provide assistance to the Vanderbilt County Health Department.
Okay.
And then confirm positive COVID-19 test protocol. Once again, please contact the school to report if your child has been tested positive or had close contact. Students have been identified. So all of those bullets are there. I think we have covered that, but they are there. If you have questions, please chime in and we'll answer those questions. But I know we're running close to an hour and a half now. School administrators, school nurse will work with health department. We've touched on that too. So.
And again, if you're just joining us, if you didn't hear us say this earlier, this plan you're going through is published, or it's in its entirety on our EVSC website.
Correct.
So if you just go to the school reopening button, it's a red button, click on that. You're going to be able to see this. You can go through it just as you are, Dr. Smith, page by page, line by line. You can print out a copy, but just know there may be times where we need to do some updates because we're in a fluid situation here.
Absolutely. Absolutely. Then page 21. When can a student return to school? I covered that for close to 30 minutes from pretty close to the onset. Once again, that's on page 7, specifically the guidance in that chart with the rows and columns that we've inserted in this book from the Indiana State Department of Health. School nurse information. Can't say enough about our healthcare professionals. Appreciate what they've done in the past and what they will continue to do. You will see their hours listed there. I want to assure you and the school nurses that we have purchased PPE for their safety of themselves and others, so they will be fully suited up. There is a designated area for suspected COVID-19 cases in each school. For safety reasons, parents will not be able to directly access the nurse's office, and we also covered that when it comes to visitation. Furniture high-touch areas will be disinfected after each use. And then these last 3 bullets, I think, are perhaps not as widely publicized as they need to be, but we're following the CDC guidance here, and it recommends that school nurses do not give nebulizer or other aerosol-producing treatments in the school setting. That's very, very important. So please contact your kiddo's primary care provider to ensure that your student has a dose meter inhaler and a spacer and a mask for the younger kids.
Okay. Can I ask you a follow-up question? You just
Yes.
covered it, or you just mentioned it as you're going through that, Dr. Smith, and I know I saw Amanda, Ebony, Stephanie, and several others have asked this. So we talked earlier about switching classes when that happens. What about doing some cleaning in between? How will that work when parents are thinking, you know, if you're sitting at a desk
Yes.
and then you move to another room? Can you comment on that?
So all of our classrooms have the hand soap dispenser in there. Additionally, every teacher will have, or every classroom then will have the alcohol-based hand sanitizer that they will have control of. We also were fortunate in order to find disinfectant wipes. Those were in incredibly short supply, so we have been able to secure those. So those will be available in every classroom, as well as just regular disinfectant with rags that can be wiped down. So there will be specific protocols, but yes, we do know that we're going to be very attentive to that in each classroom.
Okay, and some of that then too, you may have seen some of this recently. We posted a graphic on social media. It talked about the PPE in place, and
Right.
and some of that was, like you said, the spray.
Why don't we just pull that up now?
Yeah, if we could pull that up and take a look at this, and we displayed this, or we posted this on social media the other day. Let me say a couple of things about it, and then please chime in. We wanted to show people what we have as of this time. We're very pleased to have this amount. Are we suggesting it will definitely last us through the year? We're not, so we will continue to monitor, and if we need to reorder, we're going to do what it takes to make sure we keep this equipment
Correct.
on hand.
Yes. So when you look down toward, well, at the very bottom, what would in essence be 6 o'clock? The hand sanitizers, 3,500 bottles of that. But back up a little bit more, in the 5 o'clock, in terms of foggers, we have 49 of those. 44 of those are the latest iteration. They're backpack misters. And they will basically be able to disinfect, and rid a classroom, an average size classroom, of COVID-19 virus within a minute. So 1 minute after it's sprayed, it wipes out the COVID-19 virus. And then we'll also use those on our buses. I know that people ask specifically about cleaning, wiping down desk, as I said, and we didn't put that on there, but we do have wipes, so we'll utilize those. Additionally, we will have a solution of sanitizer with rags to where you can wipe down desk that way, as well as lights, light switches, doorknobs, all of those.
And while we're looking at this, I know, and you've talked a lot today, Dr. Smith, about masks, but it's been asked, are we providing masks? And correct me if I'm wrong. What we've said to people is certainly we have a lot of masks on hand. So I'm looking at surgical masks, 412,000 of them, and then there's also cloth masks and N95 masks. We're asking if people can provide their own masks. That's fantastic because that will certainly help us out. But we're going to have masks on hand should we need to give one to someone.
Absolutely. I rotate through several different masks, but early on in the pandemic, I ran out of the house, didn't have one, and then I went into the studio without a mask. Those actually, it's been quite some time ago, but we did have a mask that we were supplying at that point in time, and frankly, they're not as comfortable as the mask that I've become accustomed to. But yes, we do have those. We will also have them on our buses. 412,000 I know will not last us the entire year. I'm not expecting it to, but we will reorder when we need to.
Sure.
So we also have the N95 mask, 10,000 of those for individuals that need those. Specifically, though, also for our cafeteria workers, healthcare providers, once again, and primary grade teachers, and those that may have a weakened immune system in our staff that need to protect themselves.
And I want to clarify something here, too, because I know we probably have a lot of employees watching this. When we posted this the other day and we said something about PPE, we have on hand for students and staff. When we say staff, we mean everyone who works in the EVSC, not just teachers. Of course, teachers play a vital role. But so I want our employees to know we're not just thinking about just teachers in the classroom, because we have other employees who are dealing with students, like you said, a cafeteria worker, a counselor, a secretary.
Classroom assistants.
So when we say staff, we mean things are in place for all staff, all employees, bus drivers, that type of thing.
Correct.
Certainly not just teachers.
Correct. So bus drivers, for instance, they will have access to a face shield as well as an N95 mask, and the buses will be sprayed down in between drop-off and pickup of students at a school. So
okay, and we're going to make a note of that when we wrap here shortly. We do want to make a comment about bus riding here before we end, so we'll hold that thought for 1 second.
Next, if we look at page 22 in terms of cleaning and disinfecting, so that we have the supplies. We've not talked about all the disinfectant and the gallons and gallons of that, the 55-gallon drums or the 15-gallon drums of things that we've gotten in and we have ordered in. But when we say, and I know that this is a little benign, high-touch surfaces will be disinfected on a regular basis. Well, instead of listing light switches and doorknobs and desks, there is a regular basis and a regular protocol for that. I just want to draw attention to our public to help them understand that, yes, we have regular routines and schedules that we will adhere to for the various conditions and the various services that we're talking about. Cleaning and disinfecting following a positive test result. Want to make certain that we do lift this up. Notify Vanderbilt County Health Department. We have trained employees using the proper PPE equipment assigned to our facilities. Rooms and other areas will be deep cleaned per the guidance of local, county, and state health departments. Disinfectant will be used with those electrostatic sprayers. I call them the misters. High touch areas will be disinfected. All surfaces, both horizontal and vertical, will be disinfected. All furniture will be disinfected, and then our daily disinfecting procedures will be used in nursing stations, locker rooms, and restrooms.
I think that just speaks to the fact that throughout this whole process, all the way back to last spring, just amazing how you see different departments having to work together, because in this situation, we're not just talking about teachers or nurses, we're talking about custodians. Everyone is such a vital clog in the wheel, so to speak, to make sure that things take
And
place.
they are vital. Hats off to Daryl Angermeyer, Chief Facilities Officer, and his entire crew from Supportive Services. Our custodians done a marvelous job of getting our schools ready. We are ready, and I just appreciate all the efforts that they've gone to, including bus transfer. I mean, just tremendous number of work by many, many people.
I want to throw out one more question just because it keeps coming up.
Sure.
We talked about masks. Can you clarify a little bit? A lot of people are asking, because I know you talked about scary masks, and so people are asking if they purchase masks, not scary masks, but maybe a mask that had whatever, a pattern on it, flowers, that type of thing.
That's fine. I mean, this is one of the masks that I have used and is cleansed daily. But I appreciate the mayor providing the mask
Definitely.
to me that said "is for everyone." That's a logo. Those are certainly appropriate. What we're trying to do is just ask for everybody's help with this.
Sure. Doesn't have to be a plain mask or a certain color. Just not. I know you taught almost 20 years. You know that there could be a temptation to do a scary mask.
It can be a pattern, but we're also, not filled with words or a symbol that could be offensive to some. It's not if it's offensive to you. It's so
Sure.
Let's just use some common sense.
Okay.
Judgment.
Very good.
Okay. This is not the time to try to push the envelope on things. It's the time to help everybody, not divide. So now on page 23, and this is something that is new. We have processed transportation. I can't tell you how many thousands of hours we have processed
most definitely.
transportation. And let me start from the onset that I think everybody understands that social distancing in a bus is very, very difficult. That's why we are mandating people wear a mask if they're going to ride a bus. I also understand that some kids on our special needs bus, when we transport them individually or just one or two, we'll work with parents
on an individual basis.
And I hope you understand our heart, and when we say we will do that. But we still have a discrepancy in the number of bus riders that we anticipate for this year. I appreciate everybody filling out the questionnaire, but I want
very helpful information for planning purposes.
Very helpful. But I want to make certain that everybody that needs, not just once, but everybody that needs bus transportation can tell us. So, and I'll have you talk about the specifics, but in essence, we're going to have folks opt in to bus transportation this year, because unlike past years where we had a bit of a factor where we could accept more riders than perhaps what we had planned on, that is not the case this year. We have to know in great detail who is expecting to ride that bus. So with that, if you could let people know the communication that's going to be forthcoming.
Sure. So if you're listening to us live right now or watching us on Facebook at 6:35 right now, if you're doing that live, here in about 10 or 15 minutes, you're going to get a phone call, you're going to get a text, you're going to get an email really explaining, as you just said, Dr. Smith, for this year, you do have to enroll in bus transportation. And that would go for someone who's used the bus. If your child's a fifth grader and they've ridden every year since kindergarten, you may think, well, does that apply to me? This year it does. On the email and the text message, it will have a link that will take you to our website, which is the enrollment form. And on that enrollment form, you will have to put in information. It'll be similar to the survey in that at the end, it'll say, do you have another child in the Evsc? If you click yes, it'll take you back through it, because we need to know this for each child in your household. So I think the vital thing people have to know is, it's kind of the mathematics of it. If we're going to reduce the amount of students on a school bus, clearly we need to know how many people are riding, and we can't have surprises for planning purposes. So again, make sure you enroll for bus transportation, even if you've ridden in past years. Please know that questionnaire you referred to that I think went out about 2 weeks ago. That was great information for survey purposes to give us an idea, but this is the actual meat of it. This is where you're actually enrolling, and we're sending this out tonight, and we are asking it to be done by Friday at noon. And we can't guarantee transportation if people don't do this, so you have to enroll is the nicest way we can say it.
And I can't emphasize that enough. We want to be accommodating. We want to meet your needs, but we're also asking you to meet us halfway and tell us what your needs are.
Sure.
And if, as I've said, or you've said, if you've ridden for the last 7 years, you still need to let us know. If you're only going to ride on Tuesday and Thursday, you need to let us know.
Right.
And I think that was some confusion in the questionnaire. Well, I don't need it every day, so I checked, no, I don't need bus transportation. Well, please tell us if you need bus transportation,
Right.
if it's 2 days a week.
And this is another example of, because of COVID-19, this isn't where we want to be necessarily.
No.
We've never been this way before, but in this current environment, we have no choice.
Right, thank you. And then school nutrition, just a few bullets. We have built-in time into the school day to allow students to wash their hands prior to and after eating meals. We still will have the hand sanitizer. Also, in an effort to allow for social distancing, some students are going to eat in locations other than a classroom, okay? And that will be specific, and in just a minute or two, we'll pull up some examples of what that is off of a school who's already populated their school-specific information. Breakfast, once again, is going to vary from each site, but each school will have information about what that looks like. All food's going to be individually wrapped this year and have a lid wherever possible. So then once again, in an effort to expedite the time students spend with each other and not in line, so in other words, so that we will not congregate, we're going to have limited menu offerings. I know that when you go into restaurants now, invariably they have limited menu offerings. We're going to have an offer versus serve. That's going to be eliminated in elementary and middle, which means students are going to have to take the items on the menu, including milk, so they're not just going to pick and choose. It's going to be, that's what I referenced earlier to a grab and go. And then disposable trays and containers are going to be used for students not eating in the cafeteria. And then if we do have to close schools again, and I will tell you, parents, there's a high probability that we will all have to do virtual learning again at some point in time. Many folks throughout the nation were talking about sometime in the fall or winter. I just want to let you know that we're prepared to do that, and we will also then be offering meals available for pickup at specific school sites. So I know we've talked a lot about our EVSC reopening plan. I know we've answered a lot of questions. I am not foolish. I understand that there are probably still a lot of questions out there. Sure. Some of them may be, though, very school specific. So if we could.
Which we understand, definitely.
Right. And so let's pull up just one school site. You can see there, this is a North School reopening. On the left are a menu of options for general reopening information. And you can see that. So when these sites go live by the end of the week, you'll be able to click on that for school-specific information. But now when we look at the menu over on the left, classes and co-curricular, if you could click on, I think it's breakfast and lunch. So this has been populated specific to North High School. So in there you have information that is very, very specific to North High School in terms of, I think they're going to have 4 lines. That's a little bit far for me, away for me to read. But basically, you have that information there, and the purpose of this was not for everybody to look at how North High School is going to do it, but to give you some comfort that, okay, this level of specificity is coming to me and should be to me by the end of this week. We just want to provide you comfort.
Well, and again, as we said at the beginning when we mentioned this, we understand people are getting to the point now, the closer we get, they want some specific information from their schools. And I will say, too, schools are already working on this now. Not everyone is back in the building because, especially now with the delayed start.
And I want to remind the public, you know, our principals need to decompress over the summer, and this has not been a summer really where they could decompress. Right. Technically, our principals are not supposed to report back to work until August the 5th now. They've been working tirelessly throughout the summer.
So they will answer questions.
Yes.
So please don't hesitate to reach out to your school, but you may not have a phone that's answered at this point or an email that's answered on the same day that you would during the school year. But if you do email, for example, your child's principal of their school, you'll get an answer. Just please understand that you may have to be a little more patient because, as you said, they're not technically working every day as they are during the school
But
year.
I guarantee you they are.
They are working, yes.
So just to kind of wrap up once again, because we've come to the end of the book for the reopening, but I just want to reinforce several things. I appreciate those of you that have stayed with us going on 2 hours now, but I want to reiterate a few things. First of all, the guidance that has been put out by the Indiana State Department of Health as well as Vanderbilt County those are the guidelines that we are adhering to when you are symptomatic or asymptomatic but in close contact with, if you've tested positive, not tested positive. All of those things we wanted to put in one location so that you could access them easily. I also wanted you to see how we make decisions. So when we look at the 3 levels, the green, yellow, and red, hopefully now you understand that this is not an all or nothing scenario, that we want to be very nimble and adapt to the conditions of Vanderbilt County, but we are going to take into considerations the conditions that are present with COVID-19, the number of active cases, the rate of positivity, and that rolling rate, not just the daily positivity rate, but a 7 and 14-day average. We want to look at ICUs. We are individuals that are in the intensive care units because we don't want to overwhelm our hospitals. So what is it that we can do to take everything into consideration to make a very informed judgment? And we want people to be able to see that on a daily basis, as you can see on the screen. Level green, level yellow, level red. And while those active cases, that's not a hard and fast line, that is a very important piece of data that we look at in combination with those where you see in that box that says considerations, where we will be looking at the average daily number of positive cases, the positivity percentage, then as I said before, ICU vent utilization as well as hospitalization.
And on this graphic, we've mentioned the fact that this will be posted and updated on the website.
Correct.
We're actually going to mark with an arrow on that graphic where we're at. So when someone wants to look and see, they'll be able to see the cases. And again, I want to make sure people understand this is Vanderbilt County cases, not in Evsc, but we're basing this, we're a countywide system. We're basing it on countywide data.
Yes. And then once again, want to reiterate, we have full-time professional healthcare workers in each of our schools, and they have a direct contact with the Vanderbilt County Health Department. We have a virtual academy that is second to none. In the likely event that we will still have to go into red level and have virtual instruction for everyone, we were prepared to do that. Every student will have a device. Every student will have access to the internet. So we're prepared for whatever comes our way. And then finally, I want to thank you to our staff. I want to thank our students and our families. I want to share my appreciation for your patience. I know this is difficult for everybody. It's difficult for us. But we're trying to provide information that will give you a level of assurance that we have left no stone unturned, that the health and well-being of our students and our staff is of paramount importance, and I hope we have now demonstrated for you tangible evidence that you matter and that we're going to do everything we can to make certain that we have a great school year. I thank you for listening, and my final statement, in addition to my appreciation, is what makes Evansville and Vanderbilt County so great is our ability to work together in a collaborative way. So once again, I implore you, please take those safety precautions and take the precautions necessary to prevent the spread of COVID-19. Together, we can make this work.
I think you're going to like this. I want you to hear this before we sign off. Jeremy, who's been watching, made this comment, and I think it sums up almost what you just said, David, and that is, Jeremy says, "We are living in a historic time where no one has all the answers. Kindness would really go a long way, especially right now. Thanks to the EVSC, its staff, and all of the great parents and the wonderful kiddos for doing your part to get through this together." And I think that was pretty well said.
Jeremy, I don't know who you are, but I could not have said it better
Maybe
than that.
we'll get Jeremy in here
Thank
for
you
the
so
next
much. Hey,
podcast.
and I know there are lots of Jeremys out there, so thank you so much. Stay positive. Stay safe.
And stay
well.
tuned to EVSC Facebook, EVSC's website. Again, what you just went through, Dr. Smith, this entire reopening plan will be placed on the website. It's on there now. It'll be updated when needed along with that data. David Smith, thanks for spending this evening with us.
Thank you. Thanks to everybody.